Performing monthly breast self-exam is very important because it helps in the early detection of any abnormalities. And I've made this step so much easier by creating a step-by-step video that you can follow monthly to perform this process. Breasts are made up of fat, glands, and connective tissues, so it's essential to keep them healthy just like any other part of your body. So let's discuss how to differentiate between the benign and the malignant breast conditions and the proper steps to take if and when you discover one. A lot of women struggle with breast conditions that are either benign or malignant, which is a medical way or fancier way of saying harmless or dangerous. There are 4 types of benign breast conditions. Number 1 is fibrocystic changes. Fibrocystic changes happen when a person's breast feels lumpy or rope-like because of changes in the breast tissue. The symptoms include breast soreness and tenderness, especially right before a period. So next time before you start your period, give yourself 2 to 3 days and try to feel your breast in a circular motion or squeeze it. There might be a lump that feels like tiny beads. These are safe and common for women. And usually no treatment is needed for fibrocystic changes. But what I've done whenever I've experienced these changes is use cold and warm compress to help relieve the pain and also taking painkillers. You can also wear a more supportive bra if you're blessed with bigger bosoms. Another benign breast condition is a cyst, which is a tiny fluid-filled sac that can form in the breast tissue. The symptoms of a breast cyst may include the feeling of soft or firm lumps, which may be tender, especially right before your menstrual period. Most times, no treatment is needed for a breast cyst, but if the cyst becomes very painful and unbearable, a doctor might drain it with a needle to relieve the pain. Fibroadenoma is another harmless breast condition. It is a solid non-cancerous tumor in the breast that is usually smooth, rubbery, and movable. If you feel a small, round, and firm lumps that moves easily when you push on your breast, it could be a sign of fibroadenomas. Most fibroadenomas do not need treatment, but if they grow and cause discomfort, a doctor might suggest removing them or freezing them. Mastitis is an infection of the breast tissue that is common in breastfeeding women, but non-cancerous. This infection can cause the breast to become red, warm, swollen, and painful, and it can also cause fever and chills. Mastitis can be treated with prescribed antibiotics to help fight the infection and pain relievers to help relieve the discomfort, as well as continuing to breastfeed and pump can help clear out the infection as well. The one condition that is very harmful to women's breasts is breast cancer. And breast cancer is a disease where cells in the breast grow out of control to form a lump or a tumor. Possible signs of a breast cancer includes a new lump in the breast, changes in the size and shape of the breast, a dimpling of the skin, or nipple discharges. A treatment for breast cancer can include surgery to remove the tumor, radiation to kill the cancer cell, or chemotherapy to shrink or kill the cancer, as well as other medications. However, treatment plans usually depend on the type and stage of the cancer. Maintaining healthy breasts and preventing breast cancer involves several practices, and the one way to do that is to practice regular self-exam monthly. Performing monthly breast self-exam is very important because it helps in the early detection of any abnormalities. And I've made this step so much easier by creating a step-by-step video that you can follow monthly to perform this process. Doing a regular clinical breast exam by a healthcare professional is another way to maintain breast health and catch early signs of cancer. And women in their 20s and 30s are recommended to do a clinical breast exam every 1 to 3 years and annually for women 40 and older. Screening mammograms are also essential in the early detection of breast cancer. And if you're a woman over 40, it is recommended that you perform this screening annually or biannually, or based on individual risk factors, especially individuals with family history of breast cancer. Also, women with family history of breast cancer may consider genetic testing for mutations in the BRCA1 and BRCA2 genes. Like breastfeeding, maintaining a healthy weight, exercising regularly, limiting alcohol intake, and avoiding smoking can contribute to your breast health. All detailed videos of these healthy lifestyles are located in the YouTube Shorts section of this channel. You can watch them to see how healthy lifestyles can help prevent breast cancer risks. Ladies, listen. It is crucial to be aware of any changes in your breast, such as lumps, dimpling, or change in size and shape, and immediately report it to your healthcare professional. Taking care of your breast is critical for general health, from regular checkups and self-exams to knowing what signs to look out for, and also leading a healthy lifestyle can all help keep your breast healthy. If this content has helped you in any way, even if it's just a little bit, and you would want more health tips like this, please like and subscribe for more weekly updates.